Welcome to Longevity Now, Longevity Now FL. I'm Luigi Fontana, Scientific Director of the Charles Perkins Center and RPA Clinic at University of Sydney. So today I want to discuss with you the results of a study that we just published in Nutrition Healthy Aging. These are the results, the post hoc analysis of the calorie trials. That was a calorie restriction multi-center study on people with a BMI between 22 and 28, so slightly overweight. A 2-year trial, prescribed 25% calorie restriction. In reality, we obtain an average of 13% calorie restriction on average. These people, they lost 8 kilos. They were, again, young, 22, 50 years old, BMI 22 to 28. We already published a number of papers showing that this modest degree of calorie restriction improves multiple metabolic, inflammatory, and hormonal factors that are associated with improved health and longevity. So what this paper adds to what we already published? Well, in this paper, what we did is to compare to understand if there was a temporal association and the relative power of different anthropometric body composition and energy metabolism measure that were able to capture the effects of calorie restriction in predicting metabolic and hormonal adaptation. So basically, with a statistical analysis, we compared body weight, BMI, waist circumference with body fat and lean mass measured by DEXA, and leptin, as you know, is a marker of energy stored in the adipose tissue. If you lose weight, leptin goes down. If you gain weight, leptin goes down in your blood. And then basically a very expensive marker of energy intake, energy expenditure, energy intake, that is the level water. So we asked, which is the best? Is body composition, is body fat by DEXA or waist circumference better than body weight? Is leptin providing more information in predicting the CR-induced improvement in cardiometabolic, inflammatory, hormonal factors? And the other question we asked was, is there a threshold effect of adiposity, energy metabolism measures to trigger changes in metabolic parameters? So there is a cutoff, like, many people say, there is like a 5%, you have to lose 5% of your body weight to have improvements in cardiometabolic health. So these were the two questions we asked using this powerful data set of this randomized clinical trial in a healthy, young, slightly overweight men and women. So just to summarize, the results are that among the progressively more sophisticated measure of adiposity, body weight, and of course BMI, is the variable that is most strongly correlated with improvement in cardiometabolic and inflammatory outcomes during CR-induced weight loss, okay? Waist circumference and DEXA are not superior to body weight or BMI in detecting, in monitoring these biological modification. Moreover, we did not find a specific threshold when we apply a spline analysis. We didn't find a specific threshold in weight loss to be exceeded for changes in metabolic and inflammatory adaptations to occur. And interestingly, we found, we are confirming previous data, that even small reductions of body weight, less than 5%, cause a significant reduction in serum T3 levels. And these reduction in T3 levels, the thyroid hormone, are predictors of post-CR weight regain. So that's important, and again, reinforces a concept that I already discussed in some of my videos, that whenever you decide to lose weight, you have basically to do a lot of exercise, because weight loss induced by exercise does not significantly reduce T3 and therefore resting metabolic rate. And so your risk of regaining weight is much less. Instead of, if you lose weight only with diet, with calorie restriction, your T3 goes down, even with small reductions. So based on this paper, even with less than 5%, as I'll show you in a table in the table in a second, even with less than 5% weight loss, you have a significant reduction in T3, and this is predicting weight regain. Okay. So the strong message is that once you have established a baseline, your baseline, or a doctor or health professional has established a baseline by doing a lot of measurements, body composition, anthropometric measurements. If you want to follow if your health or the health of your patient is improving, if you monitor body weight changes, that's enough. You don't have to waste your time every time to measure waist circumference, and you have, or even worse, doing DEXAs and measuring debulkable water. Basically, if you monitor the body weight, this is more than enough to have an idea if your health is improving or not. If you lose weight, the metabolic parameters, inflammatory parameters, they are linearly improving, progressively improving. If you are regaining weight, you go in the opposite direction, and so you have a worsening of your metabolic health. So I think that's an important, easy message. Indeed, we submitted this paper to New England Journal of Medicine. It was sent 3 times out for review, and then the reviewers, they said that it was not adding important information. Of course, I strongly disagree. I think it's a very important message for health professionals, doctors, and for people, because this is a simple message. Well, there are simple messages. One is this one, that body weight is a fantastic, cheap, easy parameter to monitor. The other one is that there is no threshold for improvement in many metabolic parameters, at least based on a spline analysis, and that even small reduction in T3, less than 5% weight loss, is associated with a post-CR weight regain. Now, very quickly, this is basically the summary of the paper, but let me show you very quickly some of the tables, so you can see basically. This is table 1 with the descriptive. As you can see here, there is an improvement in many adipositive biomarkers. There are strongly correlated BMI and body weight, waist circumference, fat mass. They are strongly correlated with each other. And with an improvement in multiple cardiometabolic risk factors. You see, they are all highly significantly correlated with weight loss and CR, as you can see here. All these ones, we measure. Long list of inflammatory, lipid, glucose, insulin, IGF, BP1. And the other important message is that, as you can see here, when we did pairwise correlation matrices of adiposity with metabolic biomarkers, as you can see here, basically body weight, % weight loss, is as good as, of course, BMI, waist circumference, and fat by DEXA. Of course, but leptin and the developable water TDI by developable water are poorly correlated. And here you can see a list of all the correlation with all the cardiometabolic risk factor. Here in figure, this is the spline, the regression using the spline analysis. As you can see here, there is basically a linear improvement as the percentage of weight loss increases. There is a linear improvement. It looks like, there is not a cutoff threshold. But however, when we stratify people using a different technique in 3 groups, those who lost less than 5% of their body weight, those who lost between 5 and 10%, and more than 10%, of course, basically only T3 and TNF-alpha were significantly improved with less than 5% as a group, instead of those that lost more than 10% body weight had almost all the cardiometabolic factors that were significantly improved. Okay, so this is I think, is an interesting and post hoc analysis of the rate of calorie, and I think, they are adding some important information, practical information for people who are trying to improve their health and metabolic health, inflammatory health, and therefore all these factors that are predicting healthy longevity, and also for clinicians and health professionals that they are trying to monitor and improve their patients' health. Thank you for listening, as always. Bye now.